Welcome to the Liver Lounge, your go-to podcast for the latest updates in hepatology, featuring discussions with the world's leading experts. Joining us today is Dr. Michael Tseng, a first-year GI fellow at MedStar Georgetown University Hospital. Dr. Michael was awarded the 2022 AASLD Foundation Emerging Liver Scholar Award and will be sharing his insights on how he matched into the prestigious gastrointestinal fellowship program at Georgetown. Let's welcome Dr. Michael.
Hi, Dr. Michael. Thanks for joining us today. Do you mind just introducing yourself?
Yeah. Thanks, Shanhan. It's really pleasure to be here, and thanks for having me today. So I'm Michael Tseng. I'm one of the first-year GI fellow at MedStar Georgetown University Hospital.
Okay. What did you do like before that and stuff?
Yeah. So like, kind of, how do I get here in a way?
Yeah.
Yeah. So, kind of being overplaced rule. If I start a little roadmap for my life is, I was born in Chicago, but I grew up in Taiwan. Eventually came back for high school, college at Emory, and I actually moved back to Taiwan, and that kind of prompted me to go to medical school in Australia, which is a little bit different from most people. Because I think the opportunity that I have in the US, so I came back, applied for residency, and was fortunate to become a resident at VCU, which is Virginia Commonwealth University at Richmond, Virginia. And I graduated this year in June, and then fortunately be able to get into Georgetown for my GI fellowship.
Yeah, but you're an American citizen, right? So you don't really have the IMG status that most people hold.
Yeah, that's a great question, honestly. So I'm actually considered a US IMG. So the fact that I went to a Australian school, despite I did clinicals here at Oshner, which really provided me a lot of support to help me get into residency. I was still considered a US IMG. Mhm.
So a US IMG is the same as any other IMG? Like, is it the same compared to like someone from India or someone from Singapore? Would they still be like placed under the same basket?
I think everyone will also like have different categories. There's like non-US IMG and then US
Oh,
IMG. I think, and then also AMG, which is American Medical Graduates. So uh, traditionally, people kind of have this sort of tier systems that how they recognize that. In a way, really just to be, I think, fair is some program cannot really offer visa status, right? So
right.
for if you U.S. citizenship, then it's easier for program to invest in you and easier for them to help this transition process. So in a way, it's less work for some programs to accept U.S. Citizen than perhaps IMG compared to non-US IMG, if that makes
Okay.
sense.
Okay, so it's more like the
Yeah,
visa status rather than, but you're still like IMG per se.
exactly. So yeah, still kind of your scoring system that still kind of take quite a bit of weight, I believe. Yeah.
Okay, cool. So I mean, you mentioned your GI at Georgetown, one of the most prestigious institutions. How do you get
Thank
there?
you.
Like recording what are tips and tricks that you say to matching in such a competitive special institution?
Well, thank you. That's very kind of you. So I think kind of quoting from one of the former GI fellow, now a hepatologist at Stanford, Dr. Duan. So he was he had wrote this paper on like how to get into GI fellowship and what you should do during your interview season. What kind of thing you should prepare for. But long story short, so just to apply for GI fellowship, like most other fellowship, you need to have letters of recommendation. So likely two that in the field of what you're interested in, one from your program director, and then the other one you could have four total. The other one could just someone that you know very well, and he or she knows you very well as well, to really vouch for you to get into fellowship. You need to have a personal statement and also your CV, which will be formatted into ERAS system. Then they can talk about your research background, your prior jobs, and your medical school, as we talk about, and then the residency you went to. So those are kind of like the way to get into. But I think when you mention how do you get into GI fellowship, honestly, with competitive fellowship like GI and cardiology, and nowadays everything's getting really more and more competitive. There are more and more applicants applying for different subspecialties each year. So, at the end of the day, it's, a lot of time not up to us as well, because they're just there's only few spots, but everyone is so talented and competitive. But I think for me, really kind of diving back to why I mentioned Nikki Dawn's paper was having a mentor. And I was fortunate to meet my mentor from residency, Dr. Siddiqui, at VCU, one of the transplant hepatologists. And the field of transplant hepatology really is what sort of encouraged me to continue applying as well, because that's something I'm interested in. No matter just starting from medical school, when I got exposure to at Ochsner with patient with cirrhosis, and their recovery process doing transplant, and being part of or actually attending the transplant committee, that really provided a lot of influence during my medical school and also residency as well. So I think having a mentor that's willing to guide you and help on projects and guide you through, publishing paper, and really, provide you sort of a perspective on what's going to be like to be for example, a gastroenterologist once you graduate from fellowship, what's going to be like a transplant hepatologist once you graduate from that. So I think that's one of the most important thing, and sort of the key, factor that helped me to get in today. And then I think lastly is to mention, really, I think VCU as a whole just provide all the resources that I needed, and without them, really, I wouldn't be here today.
Yeah, actually, we do share the same mentor, Dr. Siddiqui. So it's kind of hard. Like I met him when I'm in Singapore, right? And met him online, and that's how I met you. And it's kind of funny how everything worked out from there, because I'm not in the States, but Dr. Siddiqui has been an awesome mentor. Despite me not being in the States, he always provided me life advice in general, and things of what to do. And he's really hardworking, awesome mentor. And I think it's quite rare that he's a mentor that acts in your best interest rather than his interest,
Right.
which is amazing. Despite everything, he always tells you the truth, and the truth only. And I really appreciated that from Dr. Siddiqui a lot.
Yeah, totally agree.
Yeah. So, you've done a lot of research with Dr. Siddiqui. You published quite a bit. And what are your tips and tricks to helping like residents get involved in research? Because research is a big part of the application.
Yeah. Well, obviously, I think we can always tell people to email as many professors as you can, reach out to as many people as you can. Obviously, a lot of times, draw a luck, you could be working on a data, but that would never get published, right? So I think deciding things that you're interested in definitely will push you more to do things. I think one thing for me was, Dr. Siddiqui kind of guided me through certain project, and then I look into more and sort of help develop different side project out as a group with him and other residents. So I think that helped a lot. So definitely, again, going back to, you need to be interested in this thing. Like if you kind of just doing it because you're doing it, it's kind of hard to expand your role as a researcher, and also expand your research background as well. So, and I think that's one of the biggest factor. I would say time management definitely is another important thing, because residency, as you're going through right now as an intern, you cannot, I'm sure how busy it is. You're going home, you're already so tired, but hey, you still have 20 patients of this data you got to go through about their gender, their age, their fibroscan number, their complications, so we can figure it out, is any relationship to it. That really take a toll to your mental health or your body. So I think time management is important. So knowing how to control your time, doing work hours, and even trying to squeeze time in doing if you have spare time. Like for our program, I think we fortunately have a pretty good system that we have a inpatient outpatient block. So during the outpatient block, I was able to do more research, especially during my second year. So time management is another thing that really helped residents to get more publication and also project going. And I think lastly, it's like, like me meeting you, through online or through DDW and different conferences, is to, you have to just go out there and meet people doing these conferences. Obviously, you got to have the starting point to get accepted into conferences. But I think when you start, to DW or ACG, you can kind of meet a lot of people who have similar interests and potentially to collaborate. And that's, you and me kind of did quite a few things together already. So I think all those things combined, I think will help resident become successful in research. Again, I don't think like there's still so much for me to learn and do, and so I think it's a forever learning process.
Yeah, I mean, we met in, I think, last year, DW last year, right?
Last year, yeah, last year, yeah,
That's the
in
first
San
time we met.
Diego.
Yeah, that's the first time we met in real life. And I think
Yeah.
you went to the ASSLD in 2022 or so, and that's when you got your Emerging Liver Scholar Award. So congrats on that. And
Thank you, thank you.
yeah, so it's I think many of the residents or people applying, I mean myself included, actually quite curious, like what do you say is a good amount of papers? What is considered enough? What is considered, good, or when is it not
Like a
enough?
strong candidate in a way.
What's a strong candidate?
Yeah, that's a that's a great question as well. So, I mean, kind of going back to like how busy residents and how busy residency is. It's impossible to publish like 10, 15 papers, right? So it's all, but then again, unfortunately, at times your publication become sort of, that's how program judge each candidates, because everyone's so strong. Everyone has great board scores and great letters of recommendations, and also strong interest in GI. But this is how help you distinguish. So this question is, it's a great question. So I would say, from what I gather from different fellows, is it's definitely good to have, at least one first author paper if possible. A few abstracts that in the field of gastroenterology or transplant hepatology that help you, that in a way that's aligned with your interest. So for me, a lot of my project, I think most of my projects are all in liver, because I think even now I'm still interested in transplant hepatology, and that's why I'm applying for GI, because that's part of the process. So yeah, I mean, I think now you ask me that question, now I really cannot really kind of state what's the number, but I'll say one first author, publication, like a paper, and then a few abstract, that would be pretty at least important, because I think all programs knows how challenging it is for residents to do research and get things published. I'm sure everyone's doing things, but getting things published is a whole different level, right? Because that's not just up to you working hard on the data, or have good sort of research project, but you need to be accepted. You need to be actually writing paper and get accepted into different journals.
Right.
I hope that makes sense. I know I'm kind of going to loop.
Yeah, I get it. It's quite competitive, and I guess like you say, there's no like clear cut number that you can just say that, hey, above this amount you're safe, and below this amount you're not. It's more.
Yeah, and again, other aspect to think about is also like, and sorry to cut you off, is it's also, if you have awards, you have things that you do outside of just research. You perhaps have won some like intern awards or teaching awards as a resident, or some kind of contribution. Those will be helpful too. Whatever to define you as a strong candidate. I think that, like, the program, I'm sure they look at everything as a whole.
Yeah, that's cool. Like, how do you say about your process from getting abstracts to publications? Is it how will you advise people in similar situations to move from just doing abstracts to getting published?
Oh yeah, so I'll say at least for me, I have a great mentor like Siddiqui. I also have a lot of nice fellows that's willing to include me in different projects. So Tseng was one of a second year fellow when I was an intern, and he would just say, hey, this is a cool case I saw in clinic. You want to write it up? And so I will, obviously have grant the permissions and look up on the patients and start writing up the abstract. And from I think 1 year for the ACG, I submitted 3 total. Got 2 accepted, and those all from the fellows because they're willing to just provide some of the patient that they know that's interesting that could get published. And obviously, the PI, the attendings that's in charge of the case, are willing to tell me, hey, what are the things that you can write in your abstract and get published. And some of the a lot of big papers, the things that we work on together, for example, I'm sure we formulate them in abstract first and see how they do if they get accepted into DW or ASLD, and then eventually transform into publication like a real paper. So I would say a lot of our project will like that. You start with the abstract, and that's why you have those abstract there to present in poster or presentation, and eventually hopefully you transfer them into all your data into the paper that people can understand why we want to do this research topic and why they're valuable to to be discovered.
Great. Yeah. So I mean, from your perspective, you publish quite a bit, like that. You publish quite a lot.
Thank you.
I mean,
nothing compared to you.
yeah, but you publish quite a lot. I mean, so do you think that the impact factor is a factor for for fellow matching, or do you think that?
Wow. Yeah, I think I don't think so. I think like I'm really fortunate. I am really fortunate to be able to hop on different projects, and we have this database that I helped created. And when using this database, whenever there's a paper that come out, because my contribution and with other co-resident, my name could be on it. So that definitely helped with numbers, right? And then also you have few projects that I piloted, and that's why I'm the first author for those. But if you say with index number and with I feel like that would definitely be helpful. I'm sure there's a few candidates that have high impact factor as well, but I don't know. I think that would be like really at an even higher level. So I think that definitely matters. Again, going back to research, do become something that distinguish one candidate to the other. But I don't know if programs specifically look at that number. Yeah.
Yeah. I mean, you've done papers in CGH, JHAP.
Mm-hmm.
It's kind of yourself. You're kind of outstanding candidate in that sense, right? So I don't.
Thank you again. Just it's all because team effort. So yeah.
But I don't know. Would it be a numbers game that's more advantageous, or would it be a quality game that's more advantageous? Like if somebody were to.
That's a good question. That's a good question.
Yeah, I'm just thinking.
Yeah. So I think at least what Dr. Siddiqui told me, I think quality still take precedence over numbers. Obviously, numbers does help, but if you have 2 or 3 first author, and some program will definitely do an interview. They'll ask you, what is the paper about, and why did you want to discuss it? I think being a first author, for the most part, you should be able to discuss why this paper was started, and or this project was started, and how do you formulate all these things, right? So the more that really, I will say in this sense, quality does matter quite a bit. Yeah.
Okay, cool.
Yeah.
What are some other tips and tricks you say to, aside from just research, how would you advise somebody who's applying to GI, aside from just going to conference, doing research? I think most people that I spoke to have a difficulty just getting started in research. How would they, find a good mentor, things like that?
Yeah. So it's hard. Our VCU have very strong hepatology program, and we have residents run hepatology service. So that's how I met my mentor, and that's how you meet a bunch of fellows that have similar interests and can help you on project and get into research. Some programs I know, perhaps they don't have a primary team and they just consult GI and hepatology, and it's quite challenging for them to reach out to the attendings or some of the fellows because you just don't work with them directly, right? So it is really hard. I think you just have to really do your best to email to people, and stay connected with. Nowadays, there's Twitters, Instagrams, and those are definitely helpful to help connecting people. And then going back to conferences as well, that's helpful as well. Yeah, so I think those are the few things I'll recommend. Other than research, as you mentioned, I think just really doing residency, you're just trying to learn as much as you can. You're an internal medicine resident, so really do the best, be your best self. I think every connection that I have, not just with my colleague, but my patients as well, all matters. I think my growth during residency has, been tremendous, and all the things I feel like that not I think everything happened for a reason to me. And all the encounters I all treasure. So I feel like it's a day-to-day thing, and people kind of see that too. People like not just the GI program in your institution see that, but also your colleague kind of see that who's going to vouch for you. So again, I going back to like matching the GI, it's already super, super hard. And I'm just so fortunate that this already can happen. So yeah.
Right. And I guess for those who don't try and don't get it the first time, it's always just to try again, look for different mentors, try and get above and beyond the game. There's a few. Yeah, unfortunately, I think I'm not sure myself. I've never went through the process, but it's quite challenging when everybody else is so outstanding, and to stand out, it's quite difficult. Yeah, I think
it is hard. Yeah, it is hard.
Yeah. Just wanted to know, like, what are your future plans from here, after Georgetown? What do you plan to do? Just want to get a sense.
For sure. Right now, honestly, Chen-Han, I'm just trying to learn GI. I feel like there's so much I don't know. I feel like perhaps I am comfortable with hepatology because PCU was very kind of trained a resident very strong that way. So I'm just trying to, get to seek them at this stage. Where I see myself from here, I think, I started applying for GI because I like transplant hepatology. And so I think hepatology is still one of the biggest attractions for me to continue my education in it. So likely will be applying during my third year, or beginning of the towards the second half of my second year. And I guess that will be the short-term goal for now. Yeah, but otherwise, in terms of GI, at least in the US, you can stay in academic or you can go to private. For someone that interested in transplant hepatology, likely academic will be sort of the eventual goal. But again, I think at this stage, I'm just trying to take it day by day. I'm trying to learn my GI because you really had to be a good gastroenterologist before you can be a good transplant hepatologist. Yeah.
Yeah, me too, man. I'm just trying to live day by day.
Yeah, no, I'm sure you're doing fine.
Yeah, so thanks so much, Dr. Michael. It's been great hearing from you. And thanks for providing advice to all future applicants on GI Fellow and matching. Thanks so much for your time.
Well, thanks for having me. Really appreciate it. And
we have come to the end of the episode. Thank you for joining us, and stay tuned for more captivating discussions.